alanganan. Alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiting. Sa matuluti, di ka pasisiil. Sa dagat at bundok, sa simoy at sa langit mong bughaw. May dalagang tula at awit sa paglayang minamahal. Ang islap ng wataw at lu'y tagumpay na nagniningning. Ang bituin at araw niya kailan pa may di magiging. Lupa ng araw ng walhating puta, may langit sa piling mo. Aming ligaya na pag may pangalit na pumatay ng dahil sa'yo.
Good morning, everyone. To all the Manila Times viewers and to our friends, I hope you're all doing well amid the ongoing COVID-19 pandemic. The past 20 months had been truly challenging, and the threats brought by COVID-19 has caused us to overlook other sicknesses and maladies because of the enormous impact of the disease around the world. So even as the Breast Cancer Awareness Month has already passed, the fact is that cancer in all its many forms continues its sting on so many people, particularly women. So it is crucial that awareness about the disease must continue 12-12, meaning in all months of the year. In the Philippines alone, there were 27,163 cases of breast cancer reported last year, which makes it the third leading cause of death in the country, with a 10.7% mortality rate amounting to 9,926 deaths in 2020. The numbers are continually rising each year, and it is time to delve deeper into the causes of breast cancer, its different types, and the steps Filipino women can take to know their risk factors and treatment options. MSD Philippines, together with the Manila Times, mounts this virtual roundtable titled Because We Can, Hopeful Tomorrows for Breast Cancer Patients, to provide a platform for key opinion leaders to discuss the current landscape of breast cancer science, symptoms, risks, and treatment options, and emphasize the importance of strong community support in a patient's journey. Needless to say, the pandemic has made the struggles for both patients and carers less bearable. Today, we are privileged to meet several experts, both from the local and international health community, as well as personalities who have personal experiences with cancer and how they were able to fight it. Before we start, we invite everyone to follow Hope From Within on their social media pages. To get accurate and timely information about the disease. We're flashing the links right now on your screens. For our media friends joining us today, we will be having a Q&A portion later. If you have any questions for the speakers, you can type them in the chat box and we will collate them for discussion later. Friends, it is my honor and privilege to introduce to you a very dynamic medical expert, a fellow of the Yale Maurice Greenberg World Fellows Program 2019, which is Yale University's prestigious fellowship program for rising leaders. Her instrumental role in the Universal Healthcare Act has earned her the role of Special Assistant to the Secretary of Health for UHC. She is also the Director for Health and Promotion Bureau in the Department of Health. Please welcome Dr. Beverly Hall.
Hi, good afternoon everyone, and congratulations first and foremost to the organizers of the #BC Weekend, Hopeful Tomorrows for Breast Cancer Patients. This forum is very much aligned with the objectives of the Department of Health to improve health literacy of all Filipinos, particularly around certain conditions, to also improve health-seeking behavior through our primary care providers. And then finally, to also improve access to quality and affordable health services. So in fact, breast cancer as one of the top cancers in the country remains to be a priority within the DOH. And so this is exhibited by the fact that since 2011, we do have a breast cancer medicines access program. Initially, there were only 7 sites, but we're happy to note that over the years, with the help of our legislators also, and particularly our civil society organizations and professional organizations, we have been able to grow this program, and now it's actually called the Cancer and Palliative Medicines Access Program, or CSP-MAP, and it now has 24 sites nationwide. So this is also very much in line with the objectives of the National Integrated Cancer Control Act. So I guess from the DOH side, what we really want to continue encouraging is for many of these advocacy events to continue to happen, because we will need more people to advocate for early screening and early visits to their healthcare providers when signs are there, or when there's actually perhaps genetic predisposition for our patients. So, kaya natin to basta we're all together in making sure that our cancer program remains to be vibrant and responsive to the needs of Filipino, particularly Filipino women. So, good afternoon to everyone, and I hope you all have a good day.
Thank you so much, Dr. Ho. Together with us, live all the way from Malaysia, is the head of oncology services at Pantai Hospital in Kuala Lumpur. She will be talking about the global breast cancer landscape, early signs and symptoms of breast cancer, and its types, early detection and diagnosis, as well as testing and treatment options. Let us all welcome Dr. Matsura Yusof.
Good morning, everyone. Thank you for inviting me to be here. So we are here because breast cancer is very, very important. We know that it brings a huge global impact, because Asia is the world's largest continent, comprising about probably 3/5 of the human populations, and what's happening in Asia definitely impacts the world. And breast cancer is the most common type of cancer globally, and in Asia, accounting for about 40% of all breast cancers diagnosed worldwide. So if I heard earlier that if in Philippines is the 3rd leading cause of death, it is the 2nd leading cause of cancer-related death among women in Asia. So the incidence of breast cancer in Asia, if you compare to the Western counterpart, is still lower. But in terms of proportional contribution of Asian breast cancer to the global breast cancer rates, is actually increasing very rapidly. This is in parallel to the socio-economic development in Asia. So that, not just that, in terms of mortality to incidence ratios, our mortality to incidence ratio in Asia is much higher than in Western countries. So in Asia, the breast cancer is also affecting more younger patients. And when they present with breast cancer at the beginning, they often present in a later stage, more advanced stage, and therefore we have more patients who are likely to die from the disease than those in the Western countries. And on top of that, of course, our management, our diagnostic workup, our treatment, our care services are probably not as as comprehensive or as good as optimum in the Western counterpart. So it's very, very important that we increase awareness about breast cancer, make sure that our women come forward, rather earlier than they're supposed to. We improve on our screening programs so that we can catch them any earlier, and of course, improve on the management of the patients. So if I may go to what is breast cancer? So breast cancer is the cancer that happen in the breast. So basically, it's a common term for cancerous tumor or malignant tumor that starts within the breast. And of course, from the breast, it can also spread to the lymph nodes in the armpit. And if we leave it without treating it, it can spread and metastasize to other organs, causing complication and death. And we do not want that. So we have various types of cancer of the breast. It's just not one single disease. So we have the hormone positive type, we have the HER2 positive type, and of course, the triple negative breast cancer type. And we know recently that in advanced stage cancer, we also have a breast cancer called the PIK3CA mutant type. And if, let's say, we have patients who are born with defective genes, which increases their cancer risk for cancer greatly, such as the BRCA1 or 2, then that will be called the BRCA-associated type of breast cancer. So the cancer types in breast cancer has expanded, and we are learning very fast on how to manage them, appropriately. So what are the risks for developing breast cancer in our women? So of course, the risk, when we're talking about risk, there's no single factor for breast cancer. So there's no one single factor for breast cancer. And often when we say that, what are the factors, what are the causes, we are not clear indeed, why and what could have caused the sequence of events that lead to breast cancer. So it doesn't mean that if, let's say, we have one factor or two factors, that doesn't mean that 100% we will get the cancer. So I usually I like to divide the causes to modifiable and non-modifiable factors. So non-modifiable factors are increasing age. As we are aging, we have increased risk for cancer. Any personal history of breast cancer, if the woman has early menses and late menopause, that means that they have a prolonged menstrual period throughout their life. And then if, let's say, they have family history of cancer, if they have presence of inherited defective genes, if they have had radiation, if they have children at a later age, that's more than 32 years of age, they have their first child, and then if they use hormone replacement therapy for their menopausal symptoms. So these are the ones that you can't modify it. But what are the factors that very important for us to know, which we can modify, which is alcohol use. So we can actually reduce our alcohol use. We don't smoke. We try not to be overweight or obese, because overweight or obesity is associated with increased risk of with breast cancer. And then try to get ourselves to be, more physically active. Try to do exercise and maybe get a better diet, like we higher in vegetables and fruits, and then low in processed meat or maybe trans fat. Yeah. So in terms of the signs, symptoms of breast cancer, I think this is quite important for women to know how to feel their breast. So should they have any breast lump or any thickening in the breast that feels a bit different from the surrounding tissue, go and meet your doctor. So if there's a change in shape or change in size or appearance of the breast, it looks a bit different, go and see your doctor. Or also, if, let's say, the skin looks thickened, a bit reddened, and then there's stippling in the skin, yes, you need to see the doctor. Or if there's any changes in the nipple, that means the nipple becomes inverted, protracted, or maybe rashes around the nipple, peeling, scaling of the area of the areola, then of course also see. Or if there are any, lumps or around the breast, such as in the armpit or in the neck, those are the common signs and signs of breast cancer. But there are also signs where the patient has had cancer spread, like if they have, back pain or prolonged cough, or if they have a headache and seizure. So these are late signs. So these are a little introduction, but of course we can answer any questions that you have later. Okay.
All right. Thank you. Thank you very much, Dr. Yusof. I hope you don't mind if I ask you a few questions now that I'm sure our audience probably also have. First of all, thank you for joining us all the way from Malaysia. First of all, if you could just mention again, what is the global impact of breast cancer and how do countries, whether considered first world, emerging economies, and developing countries, manage this illness?
Okay, I think the most important thing for us to highlight is that one is very common. Number two is it affects women who are younger in our area. So if let's say you go to the Western countries, their median age of women diagnosed with cancer is about 60, 65. But in our Asian population, our median age is younger. But in Malaysia, is about 48. I believe that Philippines is so similar to us because we have younger patients who are affected by breast cancer. So if we have, and then number three is the most common cancer among females. So we have the most common cancer affecting women who are younger. So these are women who are still contributing to the economy, right? So they are also looking after the children, they're also looking after the family, they're looking after the economy, and now they are being affected by this cancer that will affect a lot of things, not just social factors, family factors, but also economic impact to the country. So it's very, very important that we help these women not to be, to have morbidity from the cancer, and also not to die early from the cancer, because these are the contributing people for the society, especially in Malaysia, because this is an urban problem. So you get people who are because of lifestyle and because of the rapid economic development, so you get women in the urban areas more affected by this disease than other women. So these are the people who are contributing. So of course there's a global impact, and if you see, like I mentioned, the mortality to incidence ratio. So if let's say in the Western countries, the 5-year survival rate is about 87 and above, like 87, 92%. And patients are presenting in early stage, like stage 1 to stage 2 is the majority. But in our side, our survival is about 60 something percent. We are 20% less in terms of survival than the Western population. That's because our patients are diagnosed a bit later, and perhaps the timing to get them to get diagnosis, and then to get treatment, then to get a proper subtyping of the cancer, and then subsequently is other things that are involved as well, other cares. So these are the reason behind why we are behind, and I do not see this improve so much in the last, at least in Malaysia, in the last probably 10-20 years. Means that our survival now, 5-year survival in Malaysia is about 66%. So I suppose that we have not progressed much from there, but so much has to be done. So in our area where we do not have a lot of money to actually pay for all these expensive drugs, pay for all this expensive treatment, then we have to look at how we can increase awareness among our women, make them do breast self-examination as early as they can, maybe when they're age 25, make them know what is their family history. They could be carrying risk. And number 4 is go for screening. And then of course we have to improve on the lab services to diagnose the cancer. Then we have to improve on the diagnostic services, and of course the treatment after that. So and then there should be an audit. There should be an audit where people look at their results, and then present it to the policymakers, and hopefully the policymakers and the public can carry it forward, and maybe the media can help us in this.
Yeah, very much so. I think that's one of the reasons why it's important that we're having this now, especially because everyone's sort of forgotten about other illnesses, and with breast cancer being still the top.
Yeah, you are right, because since COVID, we see a lot of patients coming in late. We have looked at the last 1 year in Malaysia, and we find that patients come later because of COVID. One is because they themselves are scared. Second is because of the limitation of the health facility or healthcare because of COVID. Everything is COVID, but breast cancer kills too.
Definitely.
So breast cancer kills too, and it's very, very important.
You were saying, doctor, that the women who usually get them are the ones who contribute to society, meaning they
Right.
employed, they take care of their
Correct.
so
Family.
if you don't really have, like a gene for cancer, but you are very, you're very stressed and very tired, is that also a risk for, would it lead to cancer? Because some people usually say that stress may be one of the major factors that give you cancer. Is that true? I mean, should we really watch how we probably deal with things from day to day, sort of make ourselves relax every so often and things like that?
Okay, so a lot of people speaks about stress and cancer, but I think recent studies have shown that stress is not a major factor in causing cancers to happen. So I mean, and stress is a very it's a data-free zone kind of. You cannot actually calculate it. You cannot actually quantify it. So it's kind of difficult to actually say stress is an associated factor, because all of us are stressed, no matter whether you have money or not, whether you're married or you're single. Everybody has different stress. But what is more important is actually, if somebody is considered stressed, what happens is they probably neglect their health situation. So maybe when you're stressed, you laze around a lot, sedentary lifestyle a lot. You are not, you're not getting exercise as often as you should. You eat poorly. You drink. You drink to drown the stress over, and maybe you don't sleep enough. So stress causes not good kind of unhealthy behaviors. So it's more of that rather than stress per se. So it's more of unhealthy behaviors. And like I mentioned, modifiable risk factors, smoking, alcohol, and then sedentary lifestyle, poor diet. All this is actually what we can do something about. And that's actually our problem right now. We are always on the phone.
Yeah.
We are saying, oh, I'm just don't have time, right? And everybody just can't care. So if let's say we speak about breast cancer, we speak about cancer to like 20s, 30s, and they say, oh, it's not going to happen to me, like it just
Yes. But apart from well, of course, the monthly self breast exam is key to early detection. But are there other signs and symptoms of breast cancer that women should look out for? Do they feel something that should make them, sort of check on, do the check and then probably go to their doctors?
Okay, there are two things that women can do. One is actually breast self-examination, all right? Second thing is actually examination by a doctor. So women who are young, like let's say 20 plus, they can start doing breast self-examination. They should do it after, about 1 to 2 weeks after their menses, because that's when their breast is not engorged because of the menstruation, right? So that's the best thing to do. But they can also do the doctors check them. So this is also very, very important for us to highlight, because a lot of our general practitioners may not be so aware about the fact that women who are young are also at risk to develop breast cancer. So if women actively go and meet their general practitioners to get them to examine their breasts, then so the awareness would be more. So who are these women that I feel that should go? So women who are at 40 years old who can start doing mammogram or ultrasound can also do the physical examination done by their doctors, or even breast surgeons or general surgeons. So they can do that every 2 years like that. But women who are like, they have family history, either in their mother or their sister, or their family history, then they can do it about 5 years younger. So maybe at age 35. So they can do that as well. Other than that, other than breast self-examination, of course, look out for any symptoms such that is not so clear, like for example weight loss of unknown reason, or feeling fatigue, or having maybe swelling other than just the breast. So anything that is not common, they are not familiar, they have never been like that, something uncommon, just see a doctor and discuss this. So sometimes when you see a doctor, he or she may say, oh, might be nothing, you are young, whatever, but as a consumer, as a patient, they can actually request, discuss with the doctor, and I think with this kind of partnership, then the awareness will be better, not just from the public but also from the healthcare professionals themselves. So that is in terms of what women can do. Other than that, of course, you can always have your partner doing it, but I guess it's best that the women do it themselves, and it's so easy because you can just look up the how to do breast self-examination, how to feel the lemon. So look out for that, and it can easily be done.
My question is, I don't know if women watching right now have tried to do breast self-exam, on themselves, and they felt something and panicked, because I have before, and then so I've gone to the doctor and brought it there, and they're saying, no, that isn't what breast cancer is. It's just because there's something that you feel there. Is it true that supposedly what should worry you is that if the lump is hard and immovable, but when you feel something there and that you can move it around, that's not something to panic about, just to clarify.
So usually when a breast lump is different from a malignant one is different from a benign one, because a malignant one is usually hard, and then it's not as mobile as a benign one, and then sometimes it doesn't disappear, and it's usually painless. Most of the time it's painless, and this is a cause for concern, because what happened is patient will say, oh, since it's not painful, then I don't come. So we will ask them, why didn't you come any earlier? Oh, because it's not painful. But breast cancers are not painful. They are painless. One. Number two, they are hard. Number three is every day when you look at it, it's there. It doesn't disappear. So if it disappears, it's not breast cancer. So it doesn't disappear. Number four, it will be progressing. Means that today you check it, it's 2 cm, let's say, that, and the next 1 week or the next 3 weeks, it's bigger. So it is progressing. So that is something to throw you off. But of course, if you see surrounding breasts, you see like the pores look different, the nipple is a bit retracted, and then when you look at both your breasts on the mirror, right, you see that this one is a bit like smaller or larger. Then please, that is something to be concerned about. Do see a doctor ASAP.
Yes. Thank you very much for sharing that with us, Dr. Yusuf, all the practical things also that we need to learn about. And, we hope that the next time we see each other, it will be better news, and we'll have better early detection in both our countries. So, terima kasih.
Yeah, terima kasih.
Good morning. Maraming salamat from here in the Manila Times over here in the Philippines. Thank you so much.
Sure.
Our next speaker will talk about the local breast cancer landscape and how breast cancer patients are managed in the time of pandemic. Friends, let us all welcome St. Luke's Medical Global City Assistant Head and Active Consultant, Dr. Christina Galvez.
Good morning, everyone. Good morning, everyone. I'm happy to be here.
You're okay, doctor. Please go ahead.
I thought I wasn't. Okay, so with regards to the patients being seen during the pandemic time, so I think I was asked, how did our local hospitals respond to breast cancer patients' needs during the pandemic? Even during the pandemic, we never closed. So some patients of mine were asking, and they were thinking or assuming that just because there was the pandemic, all our clinics were closed. But actually, it was not. It was more of that the patients were concerned or were fearing about going to our clinics. But yes, I do agree that during the first 3 months, March, April, May last year, it was really a time wherein we really didn't know what to do during the COVID times. But because now we have more information about COVID and how we can deal with it, all hospitals, and that includes all cancer centers, all outpatient units, we have already done guidelines on how we can see cancer patients, so that we can really make sure that all cancer patients will be seen in the hospital safely and free of COVID. So yes, I've during surges, we see that there have been like decreases also in the number of patients going to our clinics. But lately, we are already back to the numbers of patients that we are seeing. So it's like 100%. And I would say that, so to all of the breast cancer patients out there, or to all cancer patients out there, all hospitals have already established guidelines and you can safely see your doctor. Please see your doctor. It's very important.
Thank you very much, Doctor. Well, we just have a few questions here that just came, if we may ask you. Unang-una po, how can you assess the Filipinos' level of awareness on the different types of breast cancer?
So, we cannot really give you like a real figure, but I would say that compared to 10 years ago, the level of awareness among Filipino women have improved immensely. But of course, it would vary depending on what hospital you are seeing your patients at. So, for example, patients in a private hospital would be more aware of their subtype. They are more likely to be researching before they see me on what they have, as opposed to patients I see in government hospitals. But yes, I feel that actually they already know what estrogen and progesterone receptor positive breast cancer mean. But I feel that for other subtypes, like for the HER2 positive and triple negative breast cancer, their level of awareness is not yet not that good. But I think more importantly, instead of just knowing what subtype you have, the more important issue is knowing what is the implication of having an estrogen receptor or a progesterone receptor positive disease, or having a HER2 positive disease or a triple negative breast cancer disease. I think that's what is more important, knowing the prognosis and how they will be treated, so that they don't compare with each other in terms of treatment. Yeah.
So I guess my question might sound a little funny, but how much should we read up on the internet? I mean, I think a lot of people panic because we read too much. So in that sense, what can you advise us when, if we just want to raise awareness, but then again, sometimes a little information just,
on the contrary, I do encourage my patient to read or research about the disease that they have. I also encourage them to join support groups, because they will learn more also from other breast cancer survivors. So those who've been there, done that. But what I do tell them that is, when they do read something in the internet or whatever, or when they hear something from their friends, even if they're well-meaning, they should all ask me about it in the end. So when they go to my clinic next time, I tell them, whatever confused you, or you feel that it's confusing, or you feel it's not right, or scares you, just talk with me. So the bottom line is, talk with your doctors. We are more than happy to discuss it with you. So so before you believe whatever you read, ask your doctors, ask your cancer doctors, please. Yes, we will discuss everything.
Definitely, you'll stress yourself out more, and as Dr. used to say, then you get depressed, and then everything just sort of But I'm sure we'll have more questions for you a little later, Dr. Galvez. We have a few more speakers that are with us, and we hope you can join us again in the Q&A.
Thank you. No problem.
Thank you so much. Yes. Our next speaker, who will talk about the importance of multidisciplinary team, is the chair of the Breast Cancer Study Group of the Philippine Society of General Surgeons. Let us all welcome Dr. Joan Tagorda. Good morning, Doctor.
Morning, everyone. Thank you for having me on behalf of the Philippine Society of General Surgeons. So the multidisciplinary team is very important in terms of giving care to our breast cancer patients. As Dr. Yusuf has illustrated earlier, the decrease in survival rate of our breast cancer patients is because of the delay in treatment from diagnosis to giving of treatment. in the Philippines or in some Asian countries, the MDT is not really fully established, and that is what we want to have because it will ensure adherence to clinical guidelines and it will vastly improve our patient outcomes.
Yes, Dr.
Yeah, can I just add something?
Oh yeah, go ahead. Yes,
So
Dr.
thanks, Dr. Jun. But I think, Dr. Jun, you can you elaborate on MDT? So maybe the public do not know what MDT is. MDT.
The multidisciplinary team.
Right.
Yes. If we could just, I think Dr. Yusuf was just asking maybe if we could define that a little bit more for those of us who don't really understand what a multidisciplinary team for breast cancer patients is.
Correct. So the multidisciplinary team is usually composed of a core team composed of your surgeons, your medical oncologist, radiation oncologist, pathology, radiology, and even your breast cancer nurses. And usually, the attending physician also joins the core team as the patient advocate. You have also a non-core team, which you can call on an as-needed basis or when the need arises. So these are usually composed of your geneticists, your physiotherapists, your nuclear medicine, plastic surgeries, and other disciplines. One important thing that we also need to consider that should be involved in the formation of your MDT is the hospital administration. So it is also best that the hospital administration is involved and it should be an institutional mandate. So the hospital administration shows support to the MDT by giving infrastructure and giving your manpower.
When you talked about the actual composition of an MDT, a multidisciplinary team, Doctora, right off the bat, I kind of thinking these are a lot of specialists, all, attending to one patient. I'd like to know, is the cost of having a multidisciplinary team quite high? And, is there a provision to support patients in terms of funding once the need for a patient with breast cancer, to connect with an MDT arises?
In terms of cost, there's really no one answer to that because I think different cancer centers have different setup. So like one cancer center has a regular MDT for service patients, and then private patients can access this through their attending physician, and then they can just then they can discuss the patient case and treatment options. Okay, another cancer center or institution has their MDT access through a nurse coordinator. And then this nurse coordinator can form the MDT for this particular case. And then the attending physician can actually choose the specific specialist that she wants or he wants in that MDT. In terms of expense, in the first example I illustrated, there's really no payment for that MDT consult. It's just that the private consult between the attending and the patient. But some institutions would have a fixed fee for the MDT amounting to about 5,000 to 8,000 pesos.
I think Dr. Galvez would like to say something with regards to this topic.
Yes. So yes, we really do want to emphasize the importance of having a multidisciplinary team for all cancer, not just breast cancer patients before you start your treatment. In terms of expenses, you know what? In the long run, it's not going to cost that much. It may seem like when you when you first at the start, it may seem like a huge amount, but actually, if you think about, if you go to all of their clinics separately, it will cost you more. Also, it will save you more because there will be no repetition of diagnostic tests or any laboratory tests that you will be doing, because everything will be done after the MDT. So there will be no repetition according to the different doctors, because all of them will be united in telling you what treatment you should be having and what are the tests that you will be needing. Also, all government hospitals actually they offer free multidisciplinary teams. So I've been with Veterans Hospital, and we have our own multidisciplinary team. And of course, all of this is free. So I think this is something that whatever hospital you are in, you can ask your primary physician that you want this option.
Okay, that's very good to know, because sometimes of course, cost is a huge concern for everybody. And, we think that maybe if we consult with so many different specialists, the fees will balloon. But it's great to know, especially in government hospitals, that this is offered for free, as you say, Dr.
And nobody came out of a multidisciplinary team meeting unhappy. Everybody comes out of it very happy, especially the patient. I guarantee you that.
Yeah,
Yes.
if I may add that, actually, it's not about cost at all. It's actually an activity that a group of doctors who are looking after the best interest of the patient, what they do is they assemble these doctors who are relevant to the patient's sequence of treatment. So you want to organize it in such a way that the end result is optimum for that particular patient. So this is something that have to be done regularly, and it's not just for breast cancer, it's actually for all cancers, and it's already being done in many countries. We are like following, trying to keep our pace together with them, but we are following as fast as we can, but we are still behind, but we are towards that. So this is something that will be beautiful if we can actually do it for our patients.
Well, we hope that multidisciplinary teams will be comprised of doctors as kind and who have such sunny personalities as the three of you.
I know, but actually, what people doctors have to move away from is actually looking at the patient with cancer just at the organ. The patient is a whole. It's a holistic kind of care. So we have to look away from, okay, I'm just going to treat the breast. It's not like that. You have to treat the whole person. So the MDT is about that as well.
Well, that's great to know. I hope that eventually, we will all have the MDTs, all over our different hospitals, also here in the Philippines. And I believe we will be talking a little bit more about support, the support that people need a little later on in the second part of our program. But for now, doctors, I hope that we could all come back in the grand Q&A at the end of the forum, so we can talk to you more and ask you for more information. For now, though, I will switch my phone off. It keeps ringing. Sorry. So we move on, I think, to the second part of our program. And, so far, definitely, we have learned so many things from our three esteemed guests, our doctors. But again, we invite everyone at this point to follow Hope From Within on their social media pages. We're flashing them right now on your screens. So you could get accurate and timely information about breast cancer. For our media friends who are joining us today, we will be having a Q&A portion later. If you have any questions for our resource persons and speakers, you can type them in the chat box and we will collate them for our discussion later. We move on now to the second segment of our program today, entitled More Hopeful Tomorrows for Cancer Patients and Their Families. Okay, we just want to emphasize that hope is a strategy to help cancer patients. It is a great ally in supporting quality of life. It is a major tool of empowerment and an element for sustaining life and the will to live. Advocacy groups and community networks hope to prolong life through medical treatment and supportive care. Or if the disease progresses, there is hope to control pain, side effects, and suffering. Patients do have to deal with their cancer patient journey alone. Even Though a lot of people receive support from family and friends, the number one reason they join a support group is to be with others who have similar cancer experiences. Some research shows that joining a support group improves both qualities of life and survival. An exemplary survivor who defied all the odds is a member of one of the most popular clans in showbiz. Her father was a noted director, her mother was an actress, her sister is a respected actress as well, and her brother is the most awarded actor in the movie industry. Friends welcome breast cancer survival and hope from within ambassador Melissa De Leon Joseph. Good morning, Miss Melissa.
Good morning to everyone. Good morning to you, Tessa, and the rest who are here in this Zoom. And I'm just so glad and thankful that you considered me as an ambassador and for hope from within. And I'd like to thank everyone for inviting me over to be able to share to you my cancer journey.
Please go on. And we would love to hear, how strong a woman you've become from this difficult challenges like this.
Like what you mentioned a while ago, Tessa, that it is definitely very important for every cancer conqueror. You used to be a survivor, but a conqueror right now, that to get into a support group. A support group is a very, very important tool for every cancer conqueror or a survivor. It helps us go on, it helps us move on, and not to forget that we are survivors. Because there are times in like the ones like me that conquered it, we tend to forget. So we forget that we were once, because I've been 14 years cancer-free, thank God for that. And whenever I'm reminded of my cancer, that's the only time that I go to physicians and doctors to have myself checked. Because if you don't do that regularly, like what all the other doctors here have mentioned, it's not going to be, they wouldn't advise to do that. We have to have ourselves checked all the time. So whenever you're in a cancer support group, you encourage everyone. You encourage each other to have others be reminded for checkups, right? Or there are times when we have a lot of questions that sometimes our doctors cannot answer, like for example, when we get together and tell each other what we're feeling emotionally and even mentally, and some people get depressed, so we get to encourage each other. So I totally believe in support groups that like what we have put up in the south of Manila. It was spearheaded by 5 core group members. These are cancer conquerors and 1 physician. We embraced each other and started off putting organizing a support group to be able to provide venue for regular meets and to host like wellness forums so that we can encourage other conquerors. And so that we could also tell them that we are not anymore survivors, but we are conquerors, reminding them that we wish to encourage them and all the others that there's life than cancer, more to life than cancer. That it is true that having cancer, it's not the end of it, but it's what we do, what we can do something out of. With our support group, which is Stage Zero Project Pink, we encourage others to encourage others, to inform those who regular, especially women, who are mostly diagnosed with breast cancer. Not that I'm excluding the men, It is also important for others to know that men also can get breast cancer, but we encourage others to be able to be well informed, to be educated with regard to this cancer. I totally believe that if we nip it in the bud, there's life to it, and then it is just very, very important. So I encourage others to get who were diagnosed with cancer, get into a support group. It helps a lot. It encourages each other. It gives information. Even if you're in pain, you can ask others that are going through the same thing, that it is normal. It could be normal, or we can remind each other to go to a physician and ask them and have themselves checked. So that's the very most important of having a support group, Tessa.
Yes. I hope you don't mind, Melissa, if we just ask you to, sort of take us back to the time when you were diagnosed with breast cancer, and how did you feel when you found out that you had it? Just for our viewers who, kind of want to, probably going through the same thing and feeling, really hopeless already, or maybe devastated. How about you initially? How did you feel, so that we will be able to realize what a support group can actually do for a breast cancer patient?
Yes. When I was diagnosed with stage 2A breast cancer, I had 3 little kids, a wonderful husband that I really longed to take care of. My kids were like 13, I think 12, and another 9, 2 boys and a girl. My girl was like 5 years old. And the ultimate thing that I wanted to do at that time, while at the same time I was working in the business and show business, I really wanted to just take care of my family, take care of my wonderful husband. But then at the time, in 2006, I was diagnosed of stage 2A breast cancer. And I thought everything will just end just like that. I felt like my life was my life stopped, and I was like suspended in air, and I was like falling down, suspended in air and falling in a cliff, not hitting bottom. So I was diagnosed, and it was an aggressive type. So the treatment is equivalent to a stage 4 patient. So I was completely blown away. Sad news. I thought it was the end of me. But thank God right now, I'm still here. I'm able to share my life journey, my cancer journey to others. And not to forget that I was encouraged and I was strengthened by a lot of promises that I would read in the Bible. My faith was even more strengthened because of all the promises that I would see in the Bible. And my husband also encouraged me and the whole family to be able to get into it. Like, there are a lot of promises, like, for example, a promise that says, it is God who arms me with strength and keeps my way secure. That is a promise. So, and a lot more promises that I really held on to. Actually, Tessa and the others here, my cancer journey was even more strengthened. In all the chemotherapy sessions that I had, those were my best times with our Lord Jesus Christ. And others here would be talking about all the terms and the treatments that should be done in a cancer journey of a person diagnosed. But with regard to me, I'd like, the only thing that I can share to everyone is that I was really strengthened, and my faith was even more strengthened because of a lot of the promises in the Bible that I would read at that time. Those were my best times with our Creator, and I cannot deny. And I would say that others would be able to go through their cancer journey or them as a survivor, but it's different when you say, were you able to go through it well? But I could say that with all confidence that I was able to go through it well. And without all the promises that I read in the Word of God, I don't think I'll be able to go through that well. And that made me what I am right now, encouraging each other in our cancer support group with our spiritual care, which helps everyone in the group, the members, that Christ has to be involved. The Lord Jesus Christ should be in the equation of all this. And if not because of that, I don't think myself and others of the members will be able to go through it well. We've seen others who went through it, but I did not see them going through it well, Tessa. I really attest to that.
Inspired by what you told us, and we're very happy that you speak of your cancer journey in a way that will really encourage other women, other patients going through it, that you can continue to live a meaningful life. And you look wonderful in the pink of health. Of course, pink is the color of breast cancer. But first of all, before I continue with the next question, Dr. Yusuf said, agreed, Miss Melissa, cancer doesn't equate death, but it could be triumph, courage, and spirituality whatever one makes it to be. That's true. So a mindset, in other words, is also a very, very important factor in beating cancer. And to have that, you will need support from so many others. My question is, Melissa, obviously you're an actress that we all know, a beautiful actress at that. Did you go through changes in your physical appearance when throughout battling with cancer? And how did your support group help you in that sense? Nowadays, we always talk about self-care as one of the very important things so that we can stay healthy. And that also means looking good, being confident about ourselves. In your case, being an actress as well, and always being admired by everybody for your physical appearances. How did that affect you when you were dealing with cancer, and who were the people also besides your faith who helped you to get through those changes?
Tessa, family is very important. On set, not only when trial comes, that family have to be really, bonded together, and whatever it is, in want or in need, in greatness or in less, we should be supporting each other, right? On set, before having my going on with my family, after getting married, we already put ourselves in the knowledge of what the Word of God is saying. So on set pa lang, in the beginning pa lang, we allowed ourselves already to be educated with regard to, should I say, educated with regard to the Word of God, so that at that time when I was diagnosed with cancer, we knew already how to hold on to Him. We knew already how to grasp the Word of God in our lives. So it is just so important, not only for those people who are going through cancer, but for those people who are starting their lives in their married life, or even young people that having that that faith with the Word of God is just so important. So what I'm trying to say here is that preparing our life, having that kind of perspective, that it's not just about us, it's not just about things going on in this country, or things going on in our lives. We just take it and just move on, and whatever it comes, just go for it. It's also about, like what I said a while ago, putting God in the center, putting our Christ Jesus in the equation, so that when we face a trial, we don't look so bad, so we don't look so sad and devastated, and that we know that there's life. Even if the Lord takes us, we have to be joyful, because in anything we have to be at peace with ourselves, because having peace in ourselves through God's word, I don't think we will lose that, lose that faith, because it is just so important that we know this, so that going through trial, we will know how to take care of not only our spiritual life, but also the people around us who can encourage us, because if not because of that, and what's going on in ourselves, how can we be able to, whatever it is that will come out in us will be, as peaceful as it is with what's going on in our hearts, in our minds. So if you're devastated inside, you're devastated outside, you look devastated. So I guess it really comes from the inside, and that's just so important. It's not only for cancer, not only for trials, but even in regular days, right? Not even with you, Tessa, and whatever it is platform you have, there should be Christ in it, because there will be no meaning if even doctors, if going through our day every day without the one that created us, definitely it's meaningless. So what will come out from our hearts, from what will exude in our being, what you put in is what you bring out, right? If you put garbage in, then garbage gonna come out. If you put the word of God in, then peace, love will come out from you, from your heart.
That's wonderful. I hope you can still join us in the Q&A a little later, Melissa. That really is very, very inspiring. Thank you for sharing that with us. And maybe a little later we can still talk about the ways where people who are battling breast cancer right now could join your Project Pink, and have the kind of support that you give to breast cancer patients. But in the meantime, just so we can get to our question and answer portion very soon, we would like to round up everything that we've discussed today, and we would like to call on the PSMO president, Dr. Bill Ramos, for his closing message before we move on to our Q&A. So, Dr. Ramos, the floor is yours. Good morning, doctor.
Good day, everyone. The cancer burden is significant and increasing. In 2020, the number of people diagnosed with cancer globally reached 19.3 million. And the number of people dying increased to 10 million. Breast cancer is the most common cancer among women in the Philippines and worldwide. It comes in third to lung and liver cancer as the cause of cancer-related death, making it a significant public health problem. Despite our endeavors on breast cancer campaigns, many Filipinos still lack adequate knowledge about breast cancer. So this information campaign is relevant. The COVID-19 pandemic impacted cancer treatment. Cancer services were partially or entirely disrupted due to the pandemic. Delays in diagnosis are common. Interruptions in therapy or abandonment have increased significantly. These disruptions and delays would likely impact the total number of cancer deaths in the coming years. Healthcare professionals have been under tremendous stress to deliver services, and there are significant reductions in research and clinical trial enrollment. The consequences of the pandemic on cancer control efforts have been profound. The survival rate among Filipino women with breast cancer is much lower than that in developed countries, primarily due to a lack of awareness and low screening rates. So many patients come to us at a late stage. Another reason why patients delay seeking consults for a possible cancer is fear. Cancer is still much linked with death. Although most cancers are potentially curable when diagnosed and treated early, it has that stigma. Seeing these cancer survivors and hearing them talk about their journey is beneficial for public health. They don't only share a story, they're sharing hope. They show the public that they survive and lead good and productive lives after a cancer diagnosis. This example can somehow reduce fear and may encourage a woman who may suspect herself to have breast cancer to seek consult without delay. We know that each person is unique and no two people are affected in the same way by their diagnosis. But people also share similarities, and many find that talking with others in the same situation can lessen the sense of isolation reported by many. So we encourage our patients to join support groups and advocacy groups. As an act of solidarity with our cancer patients, the Philippine Society of Medical Oncology, or PSMO, continues to push for the full implementation of the National Integrated Cancer Control Act, or NICA. May the promises and the vision of NICA reduce the burden of cancer in our country. The PSMO started this campaign called Sign the Petition for Cancer Assistance Fund Now. This appeals for the approval of the Department of Health's Cancer Assistance Fund to support the National Integrated Cancer Control Act. We posted the petition on our website, www.psmo.org.ph. Again, that's psmo.org.ph. We also ask for your help in sharing the said petition through social media and with any of your influential friends so that we can gather more signatures. We target 25,000 signatures and we're presently at 20,624. So that's only about 5,000 more. Isang mahalagang hakbang para sa mga mahal nating cancer patients ang pagkakalagda ng National Integrated Cancer Control Act. At ang Cancer Assistance Fund ay nakatakdang makatulong sa mga pasyenteng nangangailangan. Ngayon, panahon na para sabay-sabay nating bantayan ang aktwal na implementasyon nito. Maraming salamat po. Magtulungan po tayo para sa kalusugan, kabutihan, at kagalingan ng lahat ng Pilipino at mamamayan ng Pilipinas.
There you go. Thank you very much. Of course, we continue, I think we've gone over our hour, but we do have a lot of questions that have come in from our viewers. So we'd like to call back our panelists, Dr. Yusof, of course, Ms. Melissa De Leon, Dr. Cristina Galvez, Dr. Joanne Tagorda. I think, yes, that's all of us in the panel for the moment. And, we've had such an interesting discussion already today, not just all of the technical terms that we've learned, but also the very practical things, the very spiritual approaches that we can all make use of, or maybe at least share with people we know who are battling with breast cancer. But there are a lot of questions I think that our viewers would still like to know about, and I invite all our panelists, any of you could please just jump in and answer the questions that we'll be reading out. So the first is that, are there new treatment options to treat breast cancer? Any one of our distinguished doctors would like to answer if there are any new treatments. I think maybe the question is, usually we're all afraid of chemotherapy, you know, that's what makes us lose our hair, that what, you know, makes patients really feel very, very sick. And apparently, you know, just really in bed for days on end after chemotherapies. But I have heard that, you know, that has also been improved. Am I correct? Dr. Gavitz, you're nodding your head. Please do tell us if people should still be scared of that idea of chemotherapy.
Well, for one, chemotherapy still remains to be one of the options for cancer patients, especially in the adjuvant setting. And by this, I mean those after surgery, or for those who are needing chemotherapy prior to surgery. For example, they need to downstage. But for certain disease in the metastatic setting, meaning when they are stage 4, there are now a lot of options that are that combines targeted agents. So, like for example, for progesterone receptor positive disease, they can have now a certain targeted agent together with their endocrine treatment instead of having chemotherapy. And then for HER2 targeted agents, there are now also newer agents wherein, but well, it's still in combination with chemotherapy, but you know, chemotherapy now is very tolerable as opposed to before. And then for triple negative breast cancers, there are now immune checkpoint inhibitors together with your chemotherapy. I have to say though that, you know, I know that most patients have fear of chemotherapy, but now we are getting better at it. We are getting better of knowing how to take care of our patients. And unlike, you know, some patients think that when they are going to have chemotherapy, they will be thinner, they will look like they're dying. But you know, surprisingly, all of my patients are not even losing weight. They're actually gaining weight. And I told them, and I had to tell them not to gain weight because it's not also good for breast cancer patients. So yeah. So there are now so many options. And I have to tell you, in 2 to 3 years, every 2 to 3 years, there will always be a new agent coming in. And yes, we are always trying to find a way wherein we can avoid giving chemotherapy to our patients. And maybe Matsura would want to add something.
Okay, so thank you for your leads up. So basically, I agree with you. The treatment of breast cancer has expanded so much. So if you look at, let's say now, look at early stage cancers, as Dr. Christina has already said, yes, the patient may be treated with chemotherapy still, if they require the chemotherapy. But what people have to know is that the chemotherapy might be different. So we have different duration of chemotherapy. We have different drugs with chemotherapy that we use for different patients. And the sequence of giving chemotherapy also differs. We may give it before, we may give it after. So that is the changes that we have had. Second is the combination that she mentioned, which is we have immunotherapy now, we have targeted therapy now that we can combine with the treatment. And we also have different in terms of the duration. So if, let's say, your targeted therapy is indicated for you because you have HER2 positive type of breast cancer, if your cancer is of a very early stage, then the duration of having the targeted therapy is also less. So we try to escalate the treatment, tailoring it to the patient's needs. So if, let's say, the patient have very early stage cancers, then the treatment will be simpler. If the patient has a slightly more advanced stage, but still in the curative group, then the treatment will be more complex. So remember, go for early detection as much as you can because the treatment will be simpler. But for the metastatic setting, we have had so much advances. We have immunotherapy, which is a drug that targets your own immune system, and the own immune system will then attack the cancer or kill the cancer. And then we also have a flurry of targeted agents for HER2-positive breast cancer, and then now we have the drug, the tablet, the pills that you can use if you have hormone-positive type of breast cancer in advanced stage. Instead of chemotherapy, then you use this drug, and now you are hearing that patients with advanced stage breast cancer surviving more than 5 years, 5 years, 10 years. Last time it used to be 1 to 2 years, now it's 5 years, 10 years. So that's very, very good. And for radiotherapy as well. So I'm a clinical oncologist, so I give radiotherapy as well. So we are now giving intraoperative radiotherapy for patients who are very, very early. So when they do the surgery for their breast cancer, right, we give the radiotherapy right away during the surgery itself. So the patient doesn't have to come, after the surgery, come 3 weeks, 5 weeks for the radiation. The radiation is finished during the surgery itself. So these are among the advances. So in the future, I'm quite sure, because we have also a lot of clinical trials. So yeah, we're going to have even more. So patients are no longer survivor, they are conqueror, like what Melissa just mentioned. So we are now looking at breast cancer as a chronic disease. Patients are not, it's like diabetes now. Patients are just going to survive. So they're just one of us. They're just one of us.
If you have that mindset that it isn't just you, who has it, and that many people do have it and are able to rise from it, then it helps you. It really helps you a lot. So, and God bless all of the doctors and scientists who think about all of these, cures and new technologies and remedies for breast cancer, since a lot of people, do suffer from it. There is a question, though, where Dr. Yusuf, you did mention, and we've all said that, self-breast exam is the best way to, find out early and then treatment and so on. That we have a question from one of our viewers. They're saying, if there is a lump below my breast, would that be a sign of breast cancer? But if they felt it below the breast, not exactly, on the places that we would do breast self-exam, is that a cause for worry?
Okay, it depends on the characteristics of the lump. If, let's say, that is a lipoma or sebaceous cyst, means these are benign lumps that have been there for a long period of time. It doesn't change. It doesn't give you any trouble. Then it's most likely a benign lump, means that it's not malignant. But if you're unsure, or if there has been changes in the last, let's say, 3 months or 6 months, the lump changes. Either it ulcerates, or it becomes more colored, or it becomes bigger, it gives you pain, then please see a doctor and get it assessed. The best person to do that is the doctor nearby to you, because that doctor is able to evaluate that lump and maybe perform an investigation to confirm on that lump. So that would be what I suggest for you to do.
Thank you, doctor. Well, there's a question here. I think you've answered it earlier. Is there a way to get away with chemo as a treatment option? Dr. Yusuf has given us so many of the new treatments that are available. And obviously, it will depend on your stage and what you need. So a good relationship with your doctor is really, really very important. And if you, as I said earlier, if you have doctors as lovely and as kind as the doctors we have here today, you wouldn't be scared. Just go and ask, and you will get the help that you need. Maybe for Dr. Tagorda, the question that we have is, how serious is the obesity problem in the Philippines in relation to breast cancer? Because I'm sure a lot of us have gained so much weight over the pandemic, being locked into our houses. Is there a connection, Dr. Tagorda?
Right. As Dr. Yusuf has mentioned earlier, obesity, especially after the postmenopausal period, should be avoided because this increases your risk of getting breast cancer. So lifestyle change is really an advocacy to decrease your risk of getting breast cancer.
Okay, a follow-up to that, because you say lifestyle change is key. The next question that we have is the Western diet a big factor to the growth of breast cancer in developing countries like the Philippines? So those of us who like to eat a lot of meat, a lot of burgers, is that something that we should also rethink, Dr. Tagorda?
Right. There is also a relation to that because of your increase in fatty foods or in cholesterol. So actually, there is really no diet restrictions that is recommended, but just in moderation. Okay, so if the incidence of breast cancer, if you look across your in the country, so the urbanized areas has increased incidence of breast cancer. So that's where you see your fast food chains.
It's true. Yeah, yeah. So it's really, really also it surrounds you and it's hard. So, I mean, if anything, we would like to ask for help. Maybe there's a medication that can come out someday so we can to help us eat in moderation. Because that's my problem, the eating in moderation part. So,
Yes.
you know, if you know, do let us know. But self-discipline, it's quite a hard thing to do. Our next question, we go back to Melissa, of course. Our question from our viewer says, aside from spiritual, what other factors helped you conquer cancer? Did you also get any help from the government? Ms. Melissa?
Yes, getting help with the government. In my case, I did not I didn't go through that. A lot in our support group had to go through it. I can be honest that it's difficult. It became very difficult for them. That's why support group like ours and all the other support groups that's going on in the country are able to help them with regard to how to get help in the with the government's help, which is there are some agencies that are able to help. Difficult though, but there are some that
Somehow you can...
but it's not a dead end. Okay, it's not a dead end. Support groups like us are able to help them, guide them how to go about it, and that's what we do. Financial with regard to our support group is not possible because we don't have that money to be able to help them with regard to their treatments, but to be able to help them go through and which to go to in different agencies in the government is possible. Yes.
Connecting them with the proper agencies to be able to help them, you can get from your community and others. Yes, thank you very much for that. Here's another medical question. Our viewer said, I heard there's this immunotherapy. What is the difference between chemotherapy and immunotherapy? Any of our doctors, please?
Yeah, I think I can take that. Okay, so basic cancer cells are cells that are dividing or, proliferating, means multiplying very rapidly. So the cancer cells can be controlled via various ways. So one of the ways is using chemotherapy. So chemotherapy is basically cytotoxic. It's toxic to cyto. Cyto means cells, so it's cytotoxic. So chemotherapy kills cells rather directly by damaging the cell's DNA. So immunotherapy is basically a treatment that harnesses our own immune system. So in our body, our own immune system is there and supposedly is supposed to help us by eliminating any cancer cells, because cancer cells look foreign to our body. But for some reason, the cancer cells are smart. They basically can hide from our immune cells cell killing. So immunotherapy are drugs that are given into our body. So this drug will invigorate, means that it will basically make your immune cells now can see the cancer cells. Or now the cancer cells are more susceptible to it, and therefore it will lead to cell killing. But immunotherapy in breast cancer is given together with chemotherapy, because it's not a standalone drug for breast cancer. So you give it together with chemotherapy. So you get somewhat like a combination effect. So the chemo kills some cells, the immunotherapy enhance some immune system, the immune system kills some more cells. So you get better results compared to just giving chemotherapy alone. So at the moment for breast cancer, only triple negative breast cancer that we are using this mechanism, immunotherapy.
Thank you very much. That answers also a final question that we've received from our viewers. She was also asking if we could delve more into immunotherapy. I did miss the first question that we had. Simple as it is, I would still like to ask our panelists. Our viewers would like to know if your family has breast cancer. Does every generation in the family also get it? Is that something that we should all keep in mind, that every generation might still get it, or can it skip generations? Any of our
so maybe I can start first, and maybe Dr. Joan or Dr. Christina can add to that lah. So it's like this. In terms of cancer is a genetic problem, all right? It's a genetic disease, but hereditary genetic disease means that when you are born with that defective gene in all your cells in the body. So for example, if somebody is born with BRCA mutated gene, then that person has a higher risk of getting breast cancer, as well as other cancers like prostate, pancreas, or ovary, okay? But that doesn't mean that 100% the patient will get breast cancer, because let's say this person is born with that gene, and the lifetime risk, if this person lives to 70 years old, is about 60% to about 70%, depending on which type of gene that they carry. So there is a 30% chance that the person may not actually develop the cancer, or the patient may die before they develop the cancer, die of other causes, heart problem, whatever. So that is the hereditary predisposition, means born with that gene. Meanwhile, you have other people who have family history but not carrier of that gene. Okay, so you have to differentiate that. So if you are talking about percentage, right? In all breast cancer population, then the percentage of having that hereditary gene predisposition is only about 5 to 6%. So that is based on large studies. But if you look at younger patients, and if you look at patients who have triple negative breast cancer, and they are young, okay, let's say less than 50 years old, then the percentage of them carrying the gene is higher, say about 20%, like that, 18 to 20%. So it differs not just on the family history, but it also depends on whether the person is carrier or not. Second is, you have to look at what is the age of that family member of yours that has the breast cancer. The younger they are, let's say less than 35, the stronger the risk. Number 3 is how many. So I may have one mother and one sister and another sister. So that means that it's high, right? Although that I get it at age 60, because I have 3 first-degree relatives that have breast cancer. So it depends on that as well. So age, how many, and then what is the type cancer. For example, somebody may have breast, and then one lung, then one cervix. Another one have breast, ovary. So breast, ovary more likely to carry some sort of genes. But the best thing that for you to know is that you can test for it. So nowadays you can do genetic counseling if you are at risk, and then you can actually find out if you are carriers. So you can actually identify that. Otherwise, I think all of us may belong to the 94% that do not carry the gene by birth. Maybe Dr. Christina or June can enhance on that.
Actually, Mansura, you perfectly explained it all. So just simply, the inherited gene is what we call the BRCA1 and 2 mutation. So it's called the BRCA mutation. So it's like, it's something that has been, I think, Angelina Jolie have raised our awareness of it, especially when she had her double mastectomy, and then eventually she had her oophorectomy. Everybody now, so I get now patients are asking me, do I need to test for that gene? So like what Dr. Matsura said, yes, if you are a younger patient, premenopausal, especially those who are 40 years old or younger. So these are the patients that we do try to we encourage testing for BRCA1, 2 mutations. Also, those with first degree relatives like the mother who develop breast cancer or ovarian cancer, especially if they develop breast cancer that is triple negative breast cancer. That means there are estrogen receptor, progesterone receptor, and HER2 assay negative. So that's triple negative breast cancer. Also, if you have a family member who has ovarian cancer, pancreatic cancer, or prostate cancer, first degree or second degree, but there are a lot of them, then yes, you can get your self-test, especially if you are a young patient. So now it can so now we have it, unlike before. I think 2 years ago we don't have it, but now we have a lot of hospitals doing it now, and there are also pharmas who offer patient access so that it can be cheaper when you have it tested. But I know a time will come wherein these testings will also be incorporated in the NICA law, so that all our patients who will require genetic testing will be supported by the government. And I think this is something that should be also highlighted and should be part of the mandate with regards to the cancer care law, So I think this is something that should be also integrated for our patients, because it does cost a lot. So we are actually, we're not able to test all the patients that need it, because for some patients, it's not going to be finance-wise, they cannot access it.
Mm-hmm. So much really has to be done on
Yeah.
Yes, thank you.
Because in addition to that, we also have our geneticists already with us who help us in counseling these patients who turn out to be positive for the BRCA genes. So we already have this advantages in our clinical practice.
With with figures like you, really in the middle of it all and working so that things will get done, things that we need will get done. I think what we've learned today is that we really do have to keep supporting all of you. Support projects that raise awareness for breast cancer. Secondly, to also take care of ourselves, do the monthly breast self-exam. If you didn't get all of the different data or like the figures that our doctors have given us, I think the best thing to do is to really take care of yourself and, take responsibility for our health. And of course, as Melissa said, support and always encourage one another. So, we've got a great panel here today. They've given us everything that we need to know. And I do hope that after today, maybe we can share this information that we've learned with our family members and our friends and, help fight breast cancer. So I'd like to thank all of you for joining us today. Of course, our distinguished panelists, Dr. Matsura Yusof, Dr. Cristina Galvez, Dr. Joan Tagorda, and Ms. Melissa De Leon. Thank you so much for your time and for your passion in helping us defeat and conquer breast cancer. To our media friends, for your relentless support to this advocacy, we thank you. And to all of you who are watching, we hope, as we give hope to the afflicted, that another engaging and most informative roundtable such as this happens again in the nearest future. Keep safe, everyone, and good afternoon.
Thank you. Bye, everyone.
Thank you, ladies. Thank you so much.
Yeah, thanks, everyone. I need to go back to work now.
Thank you so much, Doctor.
Great. Thanks, Christina. Maybe we
I'll
can
see you later.
Yeah.
I'll see you later, Matsura.
Thank you.
Okay, thanks, Melissa. It was inspiring.
Thank you. Thank you.
Right, bye.
Thank you. Thank you.
Yes, sir.
Thank you, Miss Tessa.
Thank you.